Hello. Getting a new diagnosis, especially one with a long name like autoimmune pancreatitis, can feel, well, pretty overwhelming. But don't you worry. We're going to walk through this together, step by step. This video is for educational purposes only and is not a substitute for professional medical advice. Always talk to your doctor with any questions about your health.
Okay, so like we said, a new diagnosis can feel like a lot to take in, and our whole goal here is to make this feel way less overwhelming. We're just going to break it all down piece by piece so you can feel more informed and really more in control.
All right, so let's start at the very beginning with the basics. First question, what exactly is autoimmune pancreatitis?
Okay, so here's the main idea. Autoimmune pancreatitis, we'll call it AIP for short, is a pretty rare condition where your body's own defense system, the immune system, it just gets a little mixed up. So instead of only fighting off bad guys like germs, it accidentally starts to attack a healthy part of your body. And in this case, that's your pancreas. And when that happens, the pancreas gets all swollen and inflamed.
So you might be wondering, why is the pancreas so important anyway? Well, it has two really big jobs. First, it makes these special juices, or enzymes, that help you digest your food. And second, it's the control center for your blood sugar. So yeah, when it's not working right, it can throw a couple of really important things out of whack.
This usually leads to a really big question, right? Why is my own body attacking itself? And that is such a great question. To explain it, let's use a simple comparison.
Okay, so I want you to think of your immune system as your body's personal security team, like a group of highly trained bodyguards.
And usually, this team is brilliant. It's super smart, it knows exactly who the bad guys are. Things like viruses and germs. And it just springs into action to get rid of them and keep you healthy.
But with autoimmune pancreatitis, something goes a little haywire. The security team gets, well, confused.
It mistakenly sees your own healthy pancreas and thinks it's some kind of threat. So it does its job. It attacks. And that attack is what causes all that swelling and inflammation that we call AIP.
Okay, so that's the why. Now, how would you even know if this is happening? Let's get into the symptoms, what you might be feeling, and then we'll cover how doctors actually figure all this out.
All right, so there are some common signs to look for. One of the big ones is something called painless jaundice. That's just when your skin or eyes get a yellowish tint. Other things you might notice are pain in your upper belly or back, losing weight when you're not trying to, darker urine, or even getting diabetes for the first time. Now, it's really important to know that having these symptoms doesn't automatically mean it's AIP, but they're definitely signs that you should talk to your doctor.
And that brings up a really good point, right? If these symptoms could be from other things, how in the world does your doctor know for sure that it's AIP? Well, doctors have a pretty clear plan for this. It usually happens in 3 steps. First step, taking pictures. They'll use a scan, like a CT or an MRI, to get a really clear look at your pancreas. They're looking to see if it's swollen. Step 2, checking your blood. Simple blood tests can show clues, like special markers that tell us there's inflammation. And step 3, getting a closer look. Sometimes, to be absolutely sure, they might need to take a tiny, tiny sample of the pancreas. That's called the biopsy. It's the best way to know for certain.
Okay, now for what is probably the most important part of all of this, getting better. Let's talk about treatment, because this is where the path to feeling good again really starts.
Listen, if you take away just one thing from our chat today, let it be this. This condition is highly treatable. I really want that to sink in. This is not a diagnosis without hope, not at all. It's a diagnosis that comes with a very clear, very effective plan.
And the science on this is just incredibly clear. There's a great quote from the research that says AIP responds dramatically to treatment. Dramatically. That's a huge word. It means for most people, the treatment works really, really well. So what is this amazing treatment? Well, the main medicine used is something called a steroid. And remember our confused security team? The steroids basically go in and tell that team, hey, stand down, calm down, you've made a mistake. It's like hitting a reset button that tells your immune system to stop attacking the pancreas.
Now, while your doctors are handling the medicine, there are some really powerful things you can do at home to help yourself. Number 1, eat healthy foods. Just focus on a nice, balanced diet, lean proteins, lots of fruits and veggies. Number 2, if you smoke, quitting is a game changer. It's one of the best things you can do for your health because smoking can make pancreatitis worse. And number 3, talk to your team. Keep that conversation going with your doctors. Write down your questions before you go in. You are the most important person on your healthcare team.
And that brings us right to our final thought for today. As you get ready for what's next, I want you to think about this one thing. What is one question you're going to ask your doctor at your next visit? Because being prepared and being part of the conversation, that's the very first step on a path forward that is absolutely manageable. Thanks so much for taking the time to understand this with us today.